This video is based on a research article named, A Plant-Based Diet and Coronary Artery Disease. Today we're going to talk about something really important, how a plant-based diet can actually reverse heart disease. I know it sounds too good to be true, but stick with me and I'll explain why it works. Let's start with a shocking fact. Did you know that heart disease starts way earlier than we thought? A study from 1999 found that even young adults between 17 and 34 years old already have the beginnings of coronary artery disease. That's right, it starts in your teens and 20s. But here's the kicker. This disease doesn't exist in over half the world's population. Places like Okinawa, rural China, and certain parts of Africa don't have heart disease. Why? Because they eat mostly plants. Now, you might be thinking, but don't we have all these fancy drugs and surgeries to treat heart disease? Well, yes, we do. But they're not solving the real problem. They're just putting a band-aid on it. These treatments come with risks too. Each year, about 27,000 people die from complications of stent placements and bypass surgeries. That's a lot of lives lost. So, what's the solution? It's simpler than you might think. A whole food, plant-based diet. No added oils, no dairy, no meat, no fish. Just plants. I know it sounds extreme, but hear me out. In 1985, a doctor named Caldwell Esselstyn started a small study with 24 patients who had severe heart disease. After 12 years, 17 out of 18 patients who stuck to the diet had no more heart problems. Zero. Nada. Compare that to the 8 years before the study when these same patients had 49 cardiac events. That's a huge difference. But it gets even better. In a larger study in 2014 with 198 patients, 99.4% of those who followed the plant-based diet avoided any major cardiac events over 4 years. That's heart attacks, strokes, death, all avoided. And 93% of them saw their chest pain improve or completely go away. Now, you might be wondering, how does this work? Well, it's all about your blood vessels. The plant-based diet helps your blood vessels produce more nitric oxide, which is like a superhero for your arteries. It keeps them flexible and healthy. Plus, all the antioxidants in plants help reduce inflammation in your body. But here's the million-dollar question. If this diet works so well, why isn't every doctor recommending it? Well, there are a few reasons. First, most doctors don't get much nutrition education in medical school. They're trained to prescribe drugs and do procedures, not to use food as medicine. Second, some doctors worry that patients won't stick to such a strict diet. But shouldn't that be the patient's choice? Now, I know what you're thinking. This sounds great. But I love my burgers and cheese. I get it. Changing your diet isn't easy. But think about it this way. Would you rather give up some foods you enjoy, or risk a heart attack or stroke? When you put it like that, the choice seems pretty clear. Let me share a quick story with you. There was this lawyer who had heart disease and chest pain. He started the plant-based diet and quickly got better. When he went back to his cardiologist, he found out the doctor knew about this diet but never mentioned it. The lawyer was understandably upset. He said, "Why didn't you tell me about this months ago?" The doctor's response? "In my experience, patients won't follow that program." The lawyer fired back, "That should be my decision, not yours." This story shows a big problem in healthcare. Doctors often assume patients won't make big lifestyle changes, so they don't even offer the option. But shouldn't we at least have the choice? Now, you might be wondering if this is just some crazy fad diet. It's not. There's solid science behind it. Researchers at the Cleveland Clinic found that when people eat animal products, their gut bacteria produce something called TMAO, which can damage blood vessels. But guess what? People who eat only plants don't produce TMAO at all. Their gut bacteria are different. There's more evidence too. During World War II, when the Germans took all the livestock from Norway, forcing people to eat mostly plants, heart disease rates plummeted. And in Finland in the 1970s, when they started a program to get people to eat more veggies and less meat and dairy, heart disease rates dropped by 80% over 30 years. So, what does all this mean for you? Well, if you have heart disease, or if you're worried about getting it, a plant-based diet could be a game changer. It's not just about preventing heart attacks, it's about actually reversing the disease. Imagine being able to run 4 miles without chest pain, like one patient in a study who switched to this diet. Now, I'm not saying it's easy. Changing your diet is hard. But it's a lot easier than having a heart attack or going through bypass surgery. And the benefits go beyond your heart. People who follow this diet often lose weight, have more energy, and feel better overall. So, here's my challenge to you. Try it for a month. Just 30 days. See how you feel. Talk to your doctor about it. Do some research. Read Dr. Esselstyn's book, Prevent and Reverse Heart Disease. You might be surprised at how much better you feel. Remember, your health is in your hands. You have the power to change it. Don't wait for a heart attack to wake you up. Start taking care of your heart today. Who knows? You might just save your own life.